How do colds and flu differ from one another? The causes, symptoms, diagnosis and treatment. Flu, or influenza, can be interesting to differentiate from the normal virus. Both are respiratory ailments brought about by infections, and they share numerous side effects. The normal cold and influenza are both infectious, however cool side effects will quite often be milder and work on in something like 7 days to 10 days, as per the Mayo Center. While a great many people who get this season's virus recuperate in under about 14 days, the side effects are more extreme, and serious entanglements, like pneumonia, bronchitis, and sinus or ear contaminations, can create. Notice the Communities for Infectious Prevention and Counteraction, CDC. Since colds and seasonal influenza are brought about by infections, instead of microorganisms, antimicrobials are not a viable treatment choice. Symptoms and signs of the flu and colds. Both seasonal influenza and colds influence the respiratory framework. However, influenza side effects are normally more serious than those of the normal virus. There is a wide range of infections that can cause a chilly. However, the majority of these infections cause fundamentally the same as cool side effects, says Aaron E. Glatt, MD, head of irresistible sicknesses at Mount Sinai South Nassau in Oceanside, New York. Side effects that the normal cold and influenza offer might include body aches, headache, sore throat, cough, nasal congestion, sneezing. Cold and flu causes and risk factors. Seasonal influenza is brought about by flu infections. However, numerous unmistakable infections, most ordinarily rhinoviruses, can cause a virus. Normal cold side effects regularly foster around 1 to 3 days after openness to cold-causing infections. These infections can be spread through the air, individual contact, and respiratory discharges. Experiences like a handshake, contacting sullied items, and openness to a contaminated individual's wheezes or hacks. Notice the Mayo Center. Factors that can build your gamble of becoming contaminated include age. Youngsters more youthful than 5 and grown-ups north of 65 are at a higher gamble for creating confusion from seasonal influenza, as per the CDC. Season. Occasional influenza movement normally happens between October and May, influenza season, even though seasonal infections are around the entire year, per the CDC. Also, the vast majority foster colds in the colder time of year and spring. However, they can happen whenever takes note of the CDC. Weakened immune system. Infections can all the more effectively invade the body if you have a debilitated safe framework. Certain constant sicknesses, like a malignant growth, HIV or HELPS, and immune system illnesses, raise your gamble of contracting a bug or seasonal influenza, as per the CDC. As does the utilization of immunosuppressive drugs like steroids, biologics, chemotherapy, or relocation prescriptions. Smoking. Constant smoking makes your respiratory framework more helpless against cold and seasonal infections and confusions. The American Lung Affiliation reports that chilly side effects will quite often be more extreme in smokers. Ions. Pregnancy. Ladies in their second or third trimester are especially vulnerable to difficulties from this season's virus. We're not precisely certain why, but rather there has forever been whether the safe framework changes during pregnancy, says Laura Riley, MD, the seat of obstetrics and gynecology at Weill Cornell Medication and the obstetrician gynecologist in Boss at New York Presbyterian Emergency Clinic in New York City. What varieties of flu exist? There are 4 sorts of flu infections, A and B, which are generally usually connected with occasional influenza action and pandemics. C, which is moderately intriguing and causes gentle respiratory sickness. And D, which fundamentally influences steers, as per the CDC. How are the flu and cold diagnosed? PCR-based tests should be possible to search for normal colds, yet they're not commonly accessible to the general population for routine use. They're typically saved for clinic patients with pneumonia or an extreme respiratory lot contamination. In the event that your side effects are more serious, your primary care physician might arrange tests or X-beams to preclude specific sicknesses, like strep throat or pneumonia. How long do colds and the flu last? The span of cold or seasonal influenza fluctuates relying upon the infection in question and your safe framework's capacity to ward off disease. That is the reason the exceptionally youthful, more seasoned grown-ups, and individuals with ongoing sicknesses are generally powerless against viral diseases and potential difficulties. Cold and flu medication and treatment options. Remedy antiviral medications can be utilized to treat this season's virus, particularly in patients at a higher gamble of confusion, like those with asthma, diabetes, or coronary illness. Related illnesses to the flu and colds. Some illnesses have a connection to the common cold and the flu, making it possible for you to contract them after becoming ill or increasing your risk of contracting a virus. These are listed by the Mayo Clinic as follows: asthma, bronchitis, pneumonia, infected ears, nasal infections, throat infection. Watch for more informative videos. Please subscribe and like our YouTube channel at Brighter Health Info. Also visit our website www.brighterhealthinfo.com and press the bell icon.